Hey everybody, this is Dr. Vince. I'm back again for another installment, another video. Now, a lot of people out there have back pain. So what would you say if I told you that we could probably help your back pain with one exercise in about 50% of the cases? That's pretty cool because a lot of people live with back pain on an everyday basis. We know, sorry, I'm going to go into a little bit of a rant here. We know that we can classify roughly 75 to 80% of patients with back pain using mechanical diagnosis and therapy, otherwise known as the McKenzie method. And out of those 80% of people, roughly 70 to 80% of those people are extension-based responders, meaning that they get better by doing one motion. And so extension is another way of saying bending backwards. And so you'll see this exercise commonly out there in the research, and you'll definitely see it out on YouTube if you look at how to help back pain. So if you look up the McKenzie press up, that's what we're going to be discussing today, and you'll see it. It should be described the same way in multiple videos, but if not, I'll cover how it's taught and how I teach it to patients. So again, this exercise is typically given for low back pain, specifically low back pain that's radiating down the leg. Now, at no point in time should you start doing any of these exercises until you have a physical therapy evaluation, and preferably a physical therapy evaluation performed by MDT certified therapist. So I'll go through and teach the exercise. I'll give what I typically tell patients when performing the exercise, assuming they fall into this classification. So step one, you want to go down onto your belly. Okay? This is the easiest part. Oh, sorry, down onto your belly. Easiest part is just hanging out in this position anywhere from 1 to 3 minutes. You determine what happens to your symptoms. Assuming I get a favorable response, I would then progress to step 2. Step 2 would be up onto your elbows, again relaxed into this position. And again, assuming I have a favorable response, then I would move into the press up. With the press up, ideally what you're looking for is to move into this arm extended position, and I'll show you in a second, but you want to go into this arm extended position without your body maintaining this rigid nature like you would in a plank. So I'm going to give you a couple of the cues that you would hear with this exercise to try to make sure that you're doing it correctly. The first one is if you imagine that you had a pearl necklace lining up your spine all the way to your head, and we were to pick that pearl necklace up segment by segment, ideally we'd want the top segments to come up first, and then the middle segments, and then the lower segments. Hold 1 to 2, return back down lower segments, middle segments, upper segments. So again, when you're doing the exercise, the goal is upper segments, middle segments, lower segments, elbows extended, 1, 2, and then relax back down in reverse order. Okay. Typically this is issued to patients 10 to 15 reps every 2 to 3 hours, but again, this is assuming we have a favorable response. The only way you're going to really know if you're having a favorable response is to go out and read the book Treat Your Own Back, or 7 Steps to a Pain-Free Life, or to see a therapist who is well versed in how to utilize this method and what they're looking for in terms of response. Some patients that they may need a little bit more pressure, so we could tell them to move their hands back, and you'll see how that'll take me up just a little bit higher than it did the last rep compared to if my hands are forward, right? Another way that you can gain a favorable response at home is if you do a sag at the very end, and again, this is all described in Treat Your Own Back. So when you get to the top position, here, take a big breath out, and let the low back completely relax. One of the other things that I haven't mentioned yet is my foot position. Ideally, you want your heels rotated away from each other, not in this position. Okay? We want to make sure that your hip muscles are as relaxed as can be when you're going up. Otherwise, what we tend to see from some patients is they'll clench their butt muscles and then they'll go up as one big unit instead of allowing the low back to sag down. If you have any questions about how to perform the press up, ask them below. Please comment below. Also refer, like I said before, Treat Your Own Back, 7 Steps to a Pain-Free Life. They're both written by Robin McKenzie. You can also comment on the Facebook page. If there's any other exercises that you'd like to see, please feel free to comment below and I'll try to cover the exercise. Thank you and have a good day.